Hi, my name's Dr. Lisa Knopf, and I'm the Associate Director for Epilepsy Surgery with Hartford HealthCare. I'm a neurologist specializing in the treatment of seizures and epilepsy, and I work closely with neurosurgeons to help plan brain surgery in patients with seizures that don't respond to medical treatment alone. In this video, I'm going to discuss the topic of drug-resistant epilepsy. Drug-resistant epilepsy is very common, affecting 30 to 40% of people with epilepsy. There's a 47% chance of becoming seizure-free when you try your first anti-seizure medication. After this, there's a 13% chance of seizure freedom with the addition of a second anti-seizure medicine. If the second medication fails, the chance of seizure freedom drops dramatically. The current definition of drug-resistant epilepsy was coined by a task force of the International League Against Epilepsy in 2010. It's defined as a failure of adequate trials of two tolerated, appropriately chosen, and used anti-seizure medications, whether as monotherapy or in combination, to achieve sustained seizure freedom. Let's break this down some more. Adequate is defined as an appropriately high dose and frequency of med used for a sufficient length of time. Meds could have been used alone, meaning monotherapy, or in combination. Stopping a medication due to side effects does not count as a failed medication trial. Stopping after a short period of time or after only trying a very low dose also doesn't count. Appropriately chosen means that the seizure medication must have been shown to be effective for the patient's epilepsy and seizure type, preferably in a randomized controlled clinical trial. Finally, sustained seizure freedom is defined as having had no seizures or auras for at least 3 times longer than your seizure-free interval in the 12 months before you started your new medication. Since the 1990s, 17 new anti-seizure medications have come to market. Surprisingly, these new medications did not significantly reduce the number of people with drug-resistant epilepsy. So we need other options beside medications to treat our drug-resistant patients. This may include dietary therapies, brain surgery, or implantable pacemakers for the brain. Drug-resistant epilepsy can have a major impact on your quality of life. It can impact your ability to drive, perform all tasks at your job, the efficacy of your memory, your mood, and even your physical safety. This is especially the case if you have generalized tonic-clonic seizures during sleep. Our goal in treating anybody with epilepsy is not only to make you seizure-free, but to allow you to return back to your normal life, ideally free of seizures and medication side effects.